Welcome to Body Kindness. I'm Rebecca Scritchfield, creator of the Body Kindness Philosophy book and audiobook. I'm here to help you create a better life by reinventing health from the body oppressive, shaming, and you'll never be enough type of mindset to positive and joyful ways that you can spiral up your energy, mood, and your well-being at any size, shape, or weight, and as you are right now. Get started for free at bodykindnessbook.com/start. That's the sound of me smashing a stack of scales in front of some friends. And I have to say that breaking up with the scale and all the other ways I was judging, monitoring, and measuring my worth was absolutely pivotal in my life. Creating the Body Kindness philosophy and letting myself be a human being again helped me become a better mom, a better clinician, and a happier and healthier person. I believe we all have a right to decide how we want to care for ourselves, and I think we all need support in figuring out what that looks like. You don't have to do this alone. There's a whole community of like-minded people who are fed up with diets, who are embracing intuitive eating, and who are completely redefining their lives from body shame to body kindness. You are not broken. Our culture is. Find your inner caregiver and create a better life with body kindness.
We had 3 little kids. I felt like I was in labor pain every day at 4:00. It was so difficult. And so if someone said to me, I've got a protocol and it involves drinking, skunk blood, I probably would have. And because you feel so bad, but that is not necessary. And so, if there are listeners out there that have SIBO and are, so tempted to do cleanses or do these biphasic diets and things beyond a low FODMAP diet, I urge you to not do that and work with a professional to find out, where you need to go. You don't need to be on these super restrictive diets that have zero science. So that being said, the low FODMAP diet really has two kind of, the way I look at it is 2 sort of approaches. There's the full low FODMAP elimination diet that is a 3-phase elimination diet where high FODMAP foods are all eliminated.
That was Kate Scarlata. She's a Boston-based dietitian with 30 years of experience. Kate's expertise is in gastrointestinal disorders and food intolerance, with a particular focus on the application of the low FODMAP diet for functional gut disorders. And trust me, we go into conversation in this interview about the use of the word diet and how it's specifically not for weight loss. That is a big part of why I wanted to have her on the show, and many other reasons as well. I work with a lot of clients who deal with anxiety and they end up getting a medical referral for low FODMAP. And pretty much a lot of the times low FODMAP actually does not help because it was a missed anxiety diagnosis. But anyway, more about Kate. She was awarded the Outstanding Massachusetts Dietitian Award and recognized as Boston's best dietitian by Boston Magazine. Kate's the author of numerous books and articles on digestive health topics, including the New York Times bestseller, The 21-Day Tummy Diet, and her latest book, The Low FODMAP Diet Step by Step. Kate completed her postgraduate training at Brigham and Women's Hospital, a Harvard Medical School teaching affiliate. She's currently enrolled in a Master's of Public Health program at the University of Massachusetts. Kate has been an invited speaker to various scientific meetings nationally as well as internationally. I really hope that you get something powerful and meaningful out of our interview today. You cannot separate the mind from the body and feelings of fear and anxiety and stress and how that might show up with your digestive health. Kate is very committed to helping to promote the idea that you have to screen for eating disorders, that it's not appropriate to work on low FODMAP with someone who's in recovery from an eating disorder unless you're highly, highly specialized in that area. I personally get frustrated when I see low FODMAP being co-opted for do this and you'll lose weight, or even belly bloat. It's that this idea that, the food is the problem and, there's going to be some change in your body, and that's going to make everything okay. Like, you'll see when we go into the reality of the effectiveness of low FODMAP, it's kind of like not really something that's going to work for everybody. In fact, you might be surprised to hear the actual statistics on impact. Now, for those who do have a benefit, it can feel life-changing. So it's a big, important conversation to have, to discuss the nuance of all of it, and to really help to separate out the weight stigma and societal biases around, the use of the word diet, this idea that something that could be beneficial for some people could actually be co-opted by diet culture, and also how to make sense of it. So whether it's you who are doing your research or a friend, and you care deeply about body autonomy and practicing body kindness, but there's something medically going on and you're wondering what you can do. So I really hope you find this a trustworthy place to get some information and resources. And if you are getting benefit out of these conversations, I really hope you'll consider leaving a donation for the show. That is at gofundme.com/bodykindness. Thanks, and enjoy the show. Hey, Kate, welcome to Body Kindness.
So good to be here, Rebecca.
I'm so grateful to be talking to you. You really literally taught me everything I know about IBS and low FODMAP. So thank you for all that. I've been able to help a lot of people, with gut digestive health issues, and it's all thanks to you. So thank you for being in the world and for talking to me today.
Oh, I'm happy to be here, and I'm happy to learn that you've learned from me. That's awesome.
Well, let's just start off. I would love for you to share a little bit more about your background, and then anything that you want to share that's like recent successes. I know you've written several books. I don't know what you'd like to share, but let's let the audience get to know you a little bit better.
Awesome. So I've been in the field of nutrition and dietetics as a dietitian for 30 years, which is kind of crazy to think about. But what really prompted my interest in digestive health was actually my own health. So I developed a strangulated intestine while I was pregnant, 3 months pregnant with my middle son, and required immediate surgery. And I lost about 6 to 8 feet of my small intestine. And so after that, I really developed a lot of digestive distress. I was really uncomfortable after eating. Growing a baby was added extra complexities to that. I was very fortunate that my son survived the surgery and is now a 25-year-old amazing young man. But having sort of had the surgery and really didn't have any direction around diet. Actually, the surgeon said, eat anything you want. And then the dietitian came in and said, you need to be extremely low fat, which really didn't help.
Oh, wow.
So I was really kind of navigating this space by myself and became more and more interested. Didn't know anything about the low FODMAP diet because I had my surgery in 1997, or 94. So it wasn't until 2005 that I stumbled on the low FODMAP diet research. And really, when I was reading it, it was like personal bells and whistles went on. Like every food they mentioned, I was like, watermelon really bothers me, but I never really could understand the science behind that. So I became really interested in understanding the low FODMAP diet, began applying it in my patients. And really, it was really magical, to be honest with you, with some of these patients that would arrive on my door really debilitated with severe IBS. And the diet therapy was just, within 2 days, they felt remarkably better. They felt validated because they were telling the doctor diet and eating bothered them, but were unable to really connect those dots. So it's not for everyone, and we'll talk a little bit more about that in a bit. But, for the right patient with IBS, the low FODMAP diet has been really an important part of their treatment modality. And it just prompted more and more research in this area. So I have written several books. I am a New York Times bestselling author, which is pretty cool.
Hooray!
Yay! Probably my most exciting accomplishment, to be honest, is that I have 3 really wonderful kids. They're my they're just everything to me. I have run a marathon, which is to me really an amazing accomplishment as well. I married my high school sweetheart, and I'm a nerd. I love learning, and that's about me. We'll stop there.
I'm a nerd too. Proud nerds unite.
Yes.
So I know that you started something on social several years ago. It's kind of like with the acronym for IBS, but it's I believe in your story. And I'd love it if you could talk a little bit more about what that is and why why did it need to come to be?
So I started the I Believe in Your Story campaign. Really, it's a grassroots sort of effort that really has a few main key points that I wanted to accomplish. And one of them was to raise awareness of IBS, to get people to share their story. A lot of people experience IBS. It's about 1 in 7 Americans, but often live, silently and don't share their lived experience. And I wanted to provide sort of a safe place to do that. I also found that the government funding, the research funding for IBS translates to about 11 cents per IBS patient, which is really pathetic. And so I wanted a place for people to come to donate to specific research centers that are doing really state-of-the-art research. So I linked them to my site. I'm not collecting the funds per se. I'm actually just helping people that are interested in supporting IBS research find the right centers, or at least a couple centers, to click and donate on their own. And I also wanted to create more educational resources for patients, and this helps fund some of that. So free handouts I have on the Low Fodmap diet, as well as just topics on my blog. Everything from stigma associated with IBS to what a GI psychologist can do for someone with IBS, what a pelvic floor physical therapist can do for someone with IBS, topics such as gut-directed hypnosis for IBS. There's lots of different ways to treat symptoms of IBS, and I try to channel all of that through the work that I do through the I Believe in Your Story campaign.
Yeah, it's so wonderful and powerful when people can feel less alone and less isolated, like it's just me. And I think that's what I love about what you're trying to do, is to try to reduce, the stigma and the shame, because you don't really see that somebody has IBS. And like you had said before, it could be, really debilitating and interfere with your life. And whether it's preventing you from seeking diagnosis and treatment or preventing being heard when you are seeking care and support, there's a lot different ways where people can feel alone and isolated. And, let's be real, we're not talking about a bad day or two of diarrhea, or when I had my cold last week and it went from top to bottom and I just had a few days of, I feel like crap. I got better quickly, right? I do not have IBS, but for people who struggle with IBS, it can really interfere with your life. And I was hoping you could share a little bit more, whether it's for those who already have their diagnosis and will feel validated, or for those who might be concerned or curious or just wanting to know, what is it? Why, just to help for the rest of our conversation. What do you think is important for people to know or understand what's happening?
Well, first of all, I just want to back up because I want to, sort of talk about the points that you made that are really validating and just tell you a little bit about the science.
Okay.
So individuals with IBS, there was a survey study done, and what they found that IBS patients were willing to give up 25% of their remaining life for a treatment that would offer symptom relief. That averaged about 15 years they were willing to give up for a treatment. So just wrap your head around that. The other study that was done looking at post-traumatic stress disorder in patients with IBS, and they found that a little more than a quarter of patients with IBS met the criteria for PTSD. So it's a significant life-altering diagnosis. Another study, last study that I'll just mention, is a study looking at health-related quality of life. And they looked at patients with IBS, and they found that they actually measured on this special survey that they use to rate their health-related quality of life, they're actually less than people with end-stage renal disease and diabetes, which you think of end-stage renal disease as being pretty crippling. Many people are on dialysis. It's really life-altering. And yet people with IBS rated lower on their health-related quality of life.
Wow.
So it really is a debilitating condition. So let's just talk about what it is. IBS is really looked at as a disorder of the gut-brain interactions. So you may think of it as like the gut and brain are over-talking to each other. They're really hyped. And so signals from the gut and the brain, if you're highly stressed, it affects the gut a little bit more. If your gut pain is present, it might tell the brain that it's really, really present, really exaggerated. And it's we diagnose IBS by the Rome criteria, which we're in right now, the Rome 4 iteration of this criteria. And basically, it's recurrent abdominal pain that you experience at least one day per week. It's related to defecation. It's associated with a change in the frequency of stool, and that you would have and the form of the stool. And the criteria has to occur over at least a 3-month period to sort of be diagnosed with IBS. To continue on that, what causes IBS? We really don't know exactly what causes it. It's probably a combination of different things. The gut microbiota play a role. So it appears that people with IBS have different types of microbes. They tend to have more of the potential disease or causing microbes, or the more harmful types of microbes and pathogenic microbes. There's altered intestinal permeability, so things are getting through the intestine that shouldn't. There's a higher immune activation that occurs. There's a sensitivity in the gut that in the medical world we call visceral hypersensitivity. So someone with IBS that eats a bowl of chili might feel some gas, but a lot of pain, where someone without IBS might eat a bowl of chili and experience the gas but zero pain. So the way the gut handles that is different. And it does present in different forms. So you can have IBS-C, which is a constipation predominance, or diarrhea predominance, or a mixed version of that. There's also post-infectious IBS that happens to people that have had a severe gastroenteritis. And it occurs in about 10% of people that have a severe form of gastroenteritis. So that can be a cause in some people why they may get IBS. And I'll stop there and let you talk.
That was just it was really helpful, right? To help. I'm so excited to talk more about the gut brain axis, because I would say in my practice, is just, so, after I've done the training through you and I don't just focus on digestive health, but actually what got me interested in digestive health at all was because I had a lot of people complaining about, diarrhea and urges to go, and just felt it was getting in the way of their life. Even, going to a yoga class might have produced a lot of worry about whether or not they could get to a bathroom on time. And when I looked at some of the other things that were going on, they had anxiety in other areas of life. They likely had a trauma history too. And it was through my training and anxiety that got me really interested in, okay, there's probably in some ways people who have anxiety and an IBS diagnosis who could be helped with food, and I need to know and understand that. And then there might be some times where it might not be helpful because it's secondary to the anxiety or the trauma. And so I kind of had some amount of awareness of I think I need to learn more about low FODMAP and the nuances and just have a better understanding of what is really happening. And that's why I appreciate and value your training so much, because you really have the knowledge and skills and experiences to be able to separate the pieces out so we can examine them separately and then the nuanced intersections. So I would love to pivot the conversation to talking about what we know about anxiety and the IBS connection in the role of the gut-brain axis in sort of so people can better understand their bodies and what could be going on?
Absolutely. So there is a high prevalence of psychiatric comorbidities with IBS, such as anxiety and depression. There was one study that looked at this and noted that the low FODMAP diet actually helped. I believe it was out of Michigan, particularly with the anxiety piece, which is kind of interesting. So anxiety, just to back up, it's defined as the response to prolonged, unpredictable threat, a response which encompasses physiological, affective, and cognitive changes. And think about the unpredictability of IBS, right? So you can see you have no idea. Some people may be out and about and all of a sudden have an urgent need to use the bathroom and not know where the bathroom is. And that happens to them all the time, and they're trying to hold it. That's a lot of unpredictability that someone is, dealing with, living with a irritable bowel syndrome. But there's a number of different factors that play a role in anxiety and depression too. Perhaps the gut microbiota, because we know that gut microbes produce neurotransmitters that impact mood. So if those are off, that potentially could play a role in anxiety and depression as well. So there might be a gut microbiota connection. There's also just the notion of the disease state itself. So you kind of have this GI stress cycle where you have unpredictable bowel movements and you're worried about that. And then that triggers you to feel anxious and frustrated and angry. And then that amps your sympathetic, your sympathetic response, right? So your heart rate is escalated, your GI symptoms escalate with that. And then you're back to square one with GI symptoms again. And you remain in this sort of GI stress cycle unless someone can kind of teach you how to do some, control the controllables, working with a GI psychologist or a health professional that can help you mitigate that response by maybe doing some diaphragmatic breathing, which engages your relaxation response. So I often recommend diaphragmatic breathing for my patients when they're feeling hyped, to kind of settle their anxieties down, reduce their heart rate, reduce their GI symptoms, and kind of break that GI stress cycle. That's one thing that patients certainly can do. There are GI psychologists as well that can be really instrumental in dealing with patients, really because their emphasis and knowledge is based on GI disorders and the impact it has on their psychological well-being. So you can find a GI psychologist through the Rome Psychology, and I'll send you that link. There is a little sort of registry of GI psychologists that can be helpful. Gut-directed hypnotherapy is sort of another psychological intervention that also is as effective as the low FODMAP diet. So, in patients that are more amenable to trying these various more psychological types of interventions, or maybe more appropriate for those, there are interventions outside of diet, and they should very well be considered because they're evidence-based as well.
And just as a caveat, anytime we're using the word diet, we're talking about way of eating to help you take better care of yourself with your symptoms. So
absolutely. Yeah. Nutrition. Yeah. Not a diet per se. I know it has such a bad connotation. Nutrition,
we're taught that word, right? Like everything in medical nutrition therapy in school, that, this diet, that diet, that diet, that diet. And it's like, and it is taught to us that it's a way of eating. And then diet culture kind of bulldozed us into confusing people. So just always wanted to make that point.
Good point.
Let's take a quick pause from this conversation for an important message from Bernie Salazar.
Hey listeners, Bernie Salazar here, asking you to support our show. Make your contribution at gofundme.com/bodykindness, and 100% of any amount you can give goes to offset the production expenses. If 20 people can donate $25, it pays for this episode. Again, that's gofundme.com/bodykindness to chip in and support our show. We're so grateful to have you as a listener, and we thank you for your support.
So let's pivot a little bit into this idea of caring for your IBS. And maybe even if we could take it back, that you're just like, something's not right. This isn't going away. This is really bothering me. I think I need to talk to someone. In your expertise, in an ideal world, how would you guide a person through treatment options, like from getting a diagnosis into like, what are, I know we kind of started to go there with options, but this could be a good way of kind of defining the path of getting a diagnosis. When could low FODMAP come in to play as well?
So first and foremost, if you are experiencing, GI symptoms that are problematic, you should talk to your primary care doctor.
Mm-hmm.
If there's alarm features, which we would say unintended weight loss, blood in your stool, night sweats, things of that nature, all of those should be divulged to your doctor, and so that you're getting proper workup. That might involve a gastroenterologist. It might just stay with the primary care doctor who refers you out for certain procedures, but then the care is back in sort of their hands with the patient. When we've looked at in the research, not me, but in a pilot study, once patients are diagnosed with irritable bowel syndrome, in one study, they actually provided patients 10 different types of treatments. And it went for anywhere from, the low FODMAP diet to probiotics to gut-directed hypnotherapy to antidepressant medications and more.
Mm-hmm.
But what they found were the top most interesting and viewed as valuable to the patient were the holistic therapies. So patients with IBS tend to want more holistic therapies, such as diet,
Mm-hmm.
such as probiotics, such as peppermint oil, which can be very helpful in mitigating abdominal pain, such as gut-directed hypnotherapy. So you want to make sure that when you get diagnosed with irritable bowel syndrome, that you're not just provided one treatment option, that you work with your gastroenterologist or primary care doctor, and you as a patient are part of that patient shared decision making. So you should be, educated on what are the current therapies and then which ones sound appropriate to you, and then work with your doctor or dietitian or healthcare professional to really come up with the best solution together so that you are part of driving that treatment plan. I think that's really, really important as well.
Yeah. And so make an appointment, try to have as much detail as possible and explain what's happening, why it's bothering you. Your doctor can help you get a diagnosis. Can I ask about SIBO? I wasn't planning to, but now I want to, because I remember having somebody whose doctor sent them to me to try low FODMAP first. And then if that didn't work, then test for SIBO. And, I was just a little bit confused by that. Like, is that the best thing to do, or is it better to rule out and treat SIBO first? So anyway, I was just curious of what you could say about that.
I think at the end of the day, SIBO symptoms and irritable bowel syndromes really mimic one another.
Mm-hmm.
So when we're looking at IBS studies, they probably do have a number of patients that qualify for having SIBO as well.
Mm-hmm.
And we know the low FODMAP diet helps those patients. I really think you could go either way.
Okay.
But I might opt for the antibiotic therapy first. And the reason is that some people will get the antibiotic for small intestinal bacterial overgrowth and their symptoms are completely fine and they're treated and they're good to go.
Mm-hmm.
Why would we mess with their diet at that point if we don't need to, right? So in that case, I think it can be a good idea. But there's a lot of issues because the testing for SIBO is not very accurate. There's limitations with the breath test. There's, so there's lots of limitations and a lot of gray area.
Mm-hmm.
But I would say, I would also, try that. The other thing is patients have come to me for the low FODMAP diet with an IBS diagnosis. We've tried the low FODMAP diet. They get about 60% better, not completely.
Mm-hmm.
And then I bring them in to get a breath test and we can really determine if they maybe that is part of their picture as well. So I think we don't have a definitive pathway, and I think it really depends on the physician and the patient's decision.
Right.
Maybe not necessarily one direction is perfect. It's probably individual.
Right. And, I think that with your particular approach to low FODMAP, which I want to pivot to next, is that also makes a difference, because if you accidentally consult Dr. Google, you will find chat rooms and groups, or even well-intended healthcare providers that just the message seems really intense and rigid. And whether it's partially because of how it's delivered online or just meant to look like a very black and white issue, it can get overwhelming and scary. And I know that when you work with people, that you take all kinds of things into consideration, and you also try to be as liberal as you can with the way of eating. So I think that's really important for listeners to hear. So I'd love you to start with sort of the Cliff's Notes version of why low FODMAP, what is it? We'll start there, but eventually I would love to get to this idea of what's wrong with the low FODMAP, the way,
Sure.
kind of what we're doing with it in culture today that's not right, and what is more correct, because it's not the scenario of throw the baby out with the bathwater, but there are problems, I think, to make sure that we acknowledge as well.
Totally agree with you. And just to back up to your point, I always tell patients that come to see me, absolutely stay off Facebook groups, stay off of, various websites that are not run by medical professionals. Anyone that says they have a SIBO protocol per se is providing incorrect information, because we don't really have a diet SIBO protocol. Do we have information on SIBO that's evidence-based? Like there's studies that show X and a study that showed these herbals that benefited SIBO. Yes, we have some data such as that, but we don't have this is the protocol to treat SIBO. So if a provider is saying that online, I would back up your bus and X out of that site. So that's really, really important. I tell my patients that all the time. And, I've had SIBO. I'm prone to it, unfortunately, due to my intestinal surgery. I don't have an ileocecal valve like many people with Crohn's disease, which I don't have. They don't have an ileocecal valve either. And scar tissue is another risk factor. So SIBO is like IBS on steroids, the way I kind of liken it to. And so when you feel so miserable, you are so more agreeable to doing crazy things because you want to feel better. And it is really difficult to live day to day with SIBO. My husband couldn't travel. We had 3 little kids. I was felt like I was in labor pain every day at 4:00. It was so difficult. And so if someone said to me, I've got a protocol and it involves drinking, skunk blood, I probably would have. And because you feel so bad, but that is not necessary. And so, if there are listeners out there that have SIBO and are, so tempted to do cleanses or do these biphasic diets and things beyond a low FODMAP diet, I urge you to not do that and work with a professional to find out, where you need to go. You don't need to be on these super restrictive diets that have zero science. So that being said, the low FODMAP diet really has two kind of, the way I look at it is 2 sort of approaches. There's the full low FODMAP elimination diet. That is a 3-phase elimination diet where high FODMAP foods are all eliminated. That's done for about, 4 to 6 weeks. The second phase is the reintroduction phase, where we systematically add back different FODMAP containing foods to determine what triggers exist and what don't exist, so we can liberalize your diet in the phase 3. That's the most restrictive sort of, we're in the weeds a little bit with what foods have FODMAPs and, get a little bit more restrictive. The other phase that we've been applying in the US, but really never gave it a title. But Monash University recently did a paper called Controversies with the Low Fodmap Diet and did give it a title, and they call it a FODMAP Gentle diet. And in reality, I've done this FODMAP Gentle quite a bit with a lot of patients, especially children, or if I had an elderly woman that came in that I didn't really feel the need to get into the weeds with the diet, I would do more of this flexible approach. And in the FODMAP Gentle approach, you're really just restricting some of the very high FODMAP foods. So for instance, fructans are an example of a FODMAP subtype. And we would maybe restrict wheat, garlic, and onion out of the fructan group. We wouldn't get into the weeds with other types of fructans. We would eliminate things like milk and yogurt, but we might allow cottage cheese, which is eliminated, for instance, on the full elimination diet. So it's just really cherry picking out the very high FODMAP foods. And we look at the patient's diet, for instance. An example that I can provide is I'll have, an 85-year-old woman comes to my practice with her daughter, and she's having fecal incontinence and IBS symptoms. And I look at her review of her intake, and she's drinking a tremendous amount of apple juice and apple sauce with pills and things of that nature. So I might just switch those juices out and leave her the rest of her diet as is, which is what I've done. And she responded adequately for herself and for her daughter's liking. So her fecal incontinence became much more controlled, and she was completely fine. And I didn't have to get into the weeds about, looking up, the serving size for almonds is 10 almonds. I don't like to get into the weeds like that with my patients. It's not my style anyway. But yet it could be really helpful by just kind of picking out and cherry picking out those really high FODMAP sources in their quality of life. So it's helpful.
Yeah. And I think it's one of the key values and why you just don't want to do it on your own or try to do it by reading books and blogs, and really find the right fit kind of person who can be a patient listener and really observe the patterns and kind of, just like you were describing, right? Take look at somebody's eating patterns and look at what might be a likely trigger. It's like, let's start here, right? Without creating all the overwhelm and all this, because that, if you think about that feeling of, your hope and confidence that you're going to feel better is really low in the beginning of any type of change. And, how much time am I going to have to put in this? Do I have the time? Is it going to work for me? And, I just want to feel better. Like there's so much of worry that makes so much sense. It's natural. It means it's stress. It means you care about your health, your child's health, you care about your well-being, and you just want to feel better. Why wouldn't you want those things? And it's like the way a calm and patient person who wants to help you have as good a life as possible with as much flexible eating as possible and also wants to help you feel better. That is really a sweet spot type of clinician that I think we need with IBS and low FODMAP.
Totally agree with you. And, often, one of the things that I've learned in my practice is ask the individual what they're hoping for from the session, because their idea and your idea may be vastly different. It's a simple question. How can I help you today? What were you hoping to learn from me today? What would you like to leave with today from me? So that you're speaking the same language. I can remember as in my early years, you have so much knowledge. You want to share it all in the first session. Mm-hmm. And it's, no one, especially someone that has a debilitating condition that is often linked with anxiety, needs that. So it's a little bit more hand-holding and really identifying what's going to work for that patient, what they have sort of kind of come to learn and hope for, and then work together towards those goals.
Mm-hmm. You had mentioned something earlier about, so I think it was that in some people get about 60% better, not necessarily 100% better. And I think it doesn't necessarily work for everyone. Like some people might try it and not notice much of a difference at all. So can you really help share some truth telling with where we're at with it?
Sure. So I think, probably if you look at the data, it's anywhere between 50 to about 80% of people will respond to the low FODMAP diet to a point of good management. So that means 50% potentially will not. It's IBS is a very heterogeneous condition. People arrive at it from all different types of might have IBS from the minute they were born, might have IBS develop in after an infection, might have constipation, might have diarrhea. There are lots of different, reasons for people having IBS. So not everyone's going to benefit the same. And most of the research in looking at the low FODMAP diet has been done in those with diarrhea predominance. That doesn't mean it doesn't help people with constipation. It's been shown to help those patients as well. But the bulk of the research that we really can rely on has been done in people with diarrhea predominance. So that's important to note. So, and I think another, and I'm sure you wanted to bring it up, and I know we need to wrap up soon, but one of the other things I think as practitioners and even as patients to understand that when you eat food and food causes pain, you have symptom triggers, which has been identified in about 84% of people with IBS. They feel when they eat any food exacerbates their symptoms. You compensate for that, right? There's some kind of compensation, and that might be that you start restricting foods, and then maybe you're skipping meals. Maybe you skip eating during the day because eating triggers your symptoms. So why eat during the day? You need to feel well. Well, when you get into that, you're getting into some murky waters, and you're really developing a disordered eating. And it's been identified for people with GI diseases, about 23 to 24% of them have displayed disordered eating tendencies and patterns. So about a quarter of patients with GI conditions sort of meet the criteria for disordered eating. And so if you are a listener, you have IBS, and you find that you are skipping meals and you are not going out with friends to eat and you are pulling back so that your quality of life is really disrupted by this, you want to reach out for help. You want to share that this is happening and that because there is help. There's also a condition called Avoidant Restrictive Food Intake Disorder. And, this is when individuals really just, they have it's an eating disorder where they're not concerned about their weight and body image, but they have a lack or disturbance in their interest in eating. They have fear of adverse eating consequences. So this is very common in people with digestive disorders as well. And in a few of the studies, they've found, I think, up 13 to 19% of people in GI clinics demonstrate some level of this ARFID, this avoidant restrictive food intake disorder, which really, again, is, a food fear that is escalating beyond a normal pattern where a psychological intervention would be helpful, or potentially even seeing a practitioner with eating disorder expertise. If as a clinician, you suspect your patient has ARFID, you don't take care of them unless you have an eating disorder expertise. That's beyond probably, unless you really have, you're certified and have good experience. So I'm not certified in eating disorders. I can evaluate and use screening tools, determine that a patient has an eating disorder or disordered eating or ARFID. But what I do at that point then is find them the right help, because we want to de-escalate the fear and then deal with expanding their diet and finding alternative ways to treat their IBS symptoms.
Right. That's a really interesting point, that it's like from either direction, right? You could be dealing with an eating disorder or disordered eating that you don't know is actually clinically diagnosable or somewhere on the spectrum. And the anxiety component of that can be triggering the gut-brain axis like we talked about, right? And really like going into a more restrictive path is actually not helpful. It's dealing with the anxiety first. And then, if there's still digestive issues, there's a whole series of things that you could do. We talked about a lot of holistic related things from gut psychology to breath work and meditation and everything like that. And then there's the something's not right digestively. Okay, let me kind of like tinker with it, so to speak. And next thing you know, it can cross a line into disordered and even a diagnosable eating disorder. I think it's real important for us to have a conversation around that, because it's not just this silo and that silo. And, something else that I so respect when you talk about this, you talk about, well, when you're going through low FODMAP, right, it's a food intolerance. It's not an allergy. And that it opens up a perspective shifting for people to understand that difference. And so can you talk a little bit about that and how you work that out with folks that you're helping, like maybe with an example? I know you've used pizza examples before or things like that, but it's really helpful perspective-wise.
Well, I mean, just to break down, a food allergy, in very basic lingo, is going to engage your immune system. It has the potential to have an anaphylactic reaction and death. So it's a whole different ball game than food intolerance. Now, that doesn't mean that food intolerance isn't life debilitating and impact your quality of life, but it's not life threatening. Mm-hmm. So there is a big differential there. So if you were to eat a slice of pizza on a Friday night because you were home and you might get gassy and a little bloated and pain, you can be in your, sweatpants, put a warm compress on your gut, and it was worth it to you maybe because you really wanted that pizza, you were craving it. So you're not risking your life to do it, but rather making, a decision knowing that it may trigger some of your food intolerance symptoms. And that is clearly, a very different relationship than a food allergy, which may be, a life-threatening event, right?
Right. Yeah. So it's like you might be making like a body kind of self-care choice. Like, I love this pizza place. My partner and I, or my best friend and I, we just want to chill, Netflix and chill, right? And it's like, oh, like what's my weekend like? Because I might not feel good after this, like you actually can make those types of flexible decisions because it's an intolerance and not an allergy. And we don't wish intolerances or allergies on anyone, but I do think that I see a lot of fear coming out when people are, working their way through low FODMAP, that like any little decision is just, it's kind of like, perfectionism or black and white, or, oh, now you ruined it now. And yeah, you might, take a different approach and, okay, I could enjoy the taste of this. I can enjoy the moment with people. I might be able to, make some reasonable lower-ish FODMAP swaps or something to maybe kind of reduce, the amount of FODMAPs I'm taking in this moment. And that might help me feel a little bit better, but I don't have to say, no, never again, to an extreme that really can make a person feel sad and, like that they're missing out. And I just think that that's an important thing to highlight for folks.
Absolutely. It is so important. And I think, I just even being more in tune to the culture of things, right? Mm-hmm. So an example, I follow a very loose version of the low FODMAP diet. So for me, the biggest triggers are if I were to eat a ton of wheat, and that would be like, the biggest bagel in New York, mm-hmm. and onion. Those are my two triggers. Now I post a lot of pictures on Instagram. I like to be active. I like pretty food. It's mm-hmm. kind of my mother was an artist. I like that. I like that kind of thing, Yeah. So if I post something, and sometimes people are like, that's not low FODMAP. and people will kind of attack, and it's like, I'm not on a full low FODMAP diet. So just imagine that, like, I'm a professional. I know what I can eat. I know what I can't eat. But if you're just trying to work this out and you realize, like, I'm on a low FODMAP diet. I've learned that I can eat bread, and you post a picture of bread and your family's on you, or someone's going, I thought you couldn't eat that, But I mean, that is the culture we live in. I can remember running. My husband and I are runners, and we run on the weekends in town.
Yeah.
So I would be at the post office, and people in town would be like, you and Russ are running all the time. Like it was a bad thing. And I'm like, we run on Saturdays and Sundays. Like it just happens to be when you guys are around and you see us. But like, is that a bad thing? So I think we really have to think about just the culture that people are very judgy. They're really in your face about your food choices, your food decisions, your exercise patterns, your this. And you just need to like own what works best for you and make sure that it really is based on a body kindness principle, a really listening to an intuitive eating model, which we can't really get into fully today, but, like just using those tools in both your book and the intuitive eating book, where you're just honoring and listening to your body, right? You're challenging the food police, you're challenging, all of these people, like make the decisions for yourself. And the other important point here that comes up a lot is there's a lot of guilt around eating and eating choices that I see in my IBS patients. And they almost take it on like they caused their IBS. Another example in my own life, I can remember, and my mom, God rest her soul, awesome lady, love, she was the best. But when I would have a stomach ache, and for whatever reason, maybe a little stressed, maybe an onion slipped in, who knows? I wasn't always, I couldn't always identify it, but just happened to have a bad day. Her response was always, well, what did you eat? And it's like, what? And I would have to teach her, it's not always what I eat, Mom. Sometimes it's just the stress or the way my gut works, or the adhesions are pulled a certain way, or who knows? So don't always blame diet or yourself. Sometimes it's just the way your body's functioning that day for a number of different factors that we don't fully have control over. I think people put a lot of onus on themselves unnecessarily, and we need to move away from that for sure.
Yeah, I agree with you wholeheartedly. And speaking of the cultural conditions and influence, and this is by all means, it is, not everyone, not everything that you'll read about low FODMAP, but I guess I can't even be shocked anymore because of diet culture, but I definitely felt very angry about it when I see certain, kind of they're advertising themselves as like low FODMAP companies and resources, and they're intersecting like low FODMAP and weight management. And they're literally making no bones about do low FODMAP and lose weight. And I know you have an opinion on that, so I wanted to offer you a spot to share that opinion.
The low FODMAP diet is medical nutrition therapy for irritable bowel syndrome. Really, end of story. It is not a weight management tool. And, weight gain is multifactorial, as you are very well aware, and diet is not that successful in managing weight. So I really just emphasize that with my patients when they come to see me for the low FODMAP diet. I am telling them, we're doing the low FODMAP diet to manage your symptoms. And, if you are interested in a weight management approach, I'm not really your girl for that part of it, but the diet is not certainly geared for that at all.
Yeah, and I would also hope that when somebody has that concern and they go to their physician, I'm specifically imagining a higher weight person, and be like, yeah, so like, I lost some weight recently unintended, and like higher weight people are always congratulated for weight loss, and things can get missed. And so, it's just another flag to put out there that people need to believe you and your story. So be firm in it and ask for help and support. And, don't let, a clinician acknowledge, weight loss when you're complaining of like, I physically am having difficulty digesting food and it's getting in the way of my eating patterns. That you might still encounter that weight stigma just because medicine needs to do better.
Absolutely. And just, women, not being recognized for, pain syndromes and not being taken seriously. So, there's so much that needs to change. But, if you are experiencing weight stigma or just gender bias or whatever, just really being strong and rooted and, making sure that they're hearing you outside of your physicality, but what is happening on the inside of your body. And if that means being much more firm and convicted, bringing someone to be your backup if you're really not feeling well so that they can be your strong arm with you. Do what you need to do to be heard. And the other thing is when it comes to your, GI professional and your team, if you're not getting the help, I'm not saying give up on day one, but if if you get in and you're like, wow, the philosophies are very different, or they just keep they have one tool in their toolbox and it's Miralax and that's all they have for you, then you need to move on, because IBS is complicated and there should be several different types of therapies that your health team is bringing up to you so that you can treat yourself and be part of this, sort of understanding of the different types of therapies that are out there. And you're not just hearing the one treatment that, that practitioner is used to using.
Right. Just like put a Band-Aid on it, so to speak.
Right.
One more question. I know, speaking of being a nerd, right, that you care really deeply about research and evidence-based and expanding knowledge. So is there anything you could share about like where research around low FODMAP should go, needs to go, or is going that you just personally find important or fascinating that just listeners might be helped to know that as a leader in this space that there's a need there that you hope to see covered? I'd love to know.
Yeah. So from a low FODMAP standpoint, I think that there's clear connection with the gut microbiota and metabolites. For instance, a high FODMAP diet increases urinary histamine, which is a marker of immune activation. So what is that? And is that playing a role? And, can diet modulate the gut microbiome in a way that impacts mood and other things? I think understanding that metric a little better would be helpful. But I also am very hopeful that we will find different prebiotics, so different types of food sources for our health-promoting bacteria in our intestine that modify the gut bacteria in a way that it mitigates symptoms so that we don't. I think the low FODMAP diet has taught us a lot and we're learning from it. I'm hopeful that it's just the beginning of understanding the science and that we come up with easier ways to get the same symptom relief, whether it's using prebiotic fibers, like I mentioned. There's some exciting research in that area. Fecal microbial transplants is starting to kind of come around a little bit in this area as well. So I think that area is going to be really interesting and also really validating for a number of patients because, just saying like you're stressed out and this caused your IBS is really putting a lot of the blame and onus on the patient. And I think there is something underlying going on that's contributing to all of this that we need to understand better so the patient can understand it better too.
Yeah. And find more freedom and peace and happiness and hopefully, feel as good as you can. We also have that societal pressure that every day we're only supposed to feel physically, amazing, like, Adonis, right?
Right.
It's like, no, we also, there's a lot of chronic conditions or pains and it's not a personal failure. It's actually a sign that we need more human connection, community, and empathy and understanding because we act like we're all supposed to have this pain-free life. And that's actually not at all what the human experience is about. And I know you care so much about this field and helping people with IBS. And I so appreciate you taking the time to talk. I would love it if you could share how folks can find you and connect to you and your social website, books, anything else that you want to share today.
Oh, thank you. So you can find me at katescarlata.com. That's KATESCARLATA. I'm also active on Instagram, which is just my name again, Kate Scarlata. I'm active on Twitter, and it's Kate Scarlata _RD. And my latest book is the Low Fodmap Diet Step by Step, and that's available on Amazon. I like to use that book with a dietitian so that you really tailor the diet to your personal needs.
That sounds amazing. Well, I'll make sure I include all these lovely links in the show notes. And thank you again so much. And I can't wait to see you soon sometime.
Yay! Yes, definitely. So I'm grateful for this opportunity, Rebecca. Thanks for having me on.
And that's our show. The podcast is made possible with support from listeners. Please donate to help offset production costs at gofundme.com/bodykindness. And please rate and review the show when you have a moment. It really matters. Let's keep the conversations going on Facebook. Search Body Kindness and request to join the group for Body Kindness readers and listeners. Have a question for us to answer on a future episode? Visit bodykindnessbook.com/question. Body Kindness books and audiobooks are available wherever books are sold. To request a signed print copy, visit bodykindnessbook.com/order. For other questions about this podcast, please email info@bodykindnessbook.com.